Thank you, Mr. Speaker, sir. Mr. Speaker, sir, I'd like to thank the honourable member for his question. Mr. Speaker, sir, we do have a public-private partnership policy. You can actually go to www.economy.gov.fj and you'll find that policy there. And that public-private partnership policy actually applies to all sectors. Public-private partnership is when a government or government agency is involved in that relationship. So the public-private partnership with Lautoka and Ba Hospital is where the government has given out the Lautoka and Ba Hospital on a concession to the private company that is 80% owned by FMPF and 20% owned by Aspen of Australia. The MEOT relationship has got nothing to do with government. MEOT had a commercial arrangement with Suva Private Hospital, which is actually owned by BSP. So that relationship is between them. Now, if there are any insurance policies in place, those insurance policies will obviously continue irrespective of who is there in Suva Private, because from what I understand, I do not know which specific policy you're talking about, the police also gets repatriated offshore. So they are, if they are with MEOT, obviously the MEOT hospitals in India continues to operate, and they'll continue in any case. But please understand that the MEOT presence at Suva Private is a relationship between BSP and MEOT. It's got nothing to do with government. They, of course, have been the beneficiaries of the tax incentive we've given, because they were able to get the tax concession.
I thank the Honourable Minister. We'll move on to the next question.